Welcome again to my classroom. This is the part 6 of the lecture about the Philippine Nursing Law. Section 20 discusses registration by reciprocity. Now, what is reciprocity? Reciprocity means that there is a treaty or a bilateral agreement between the Philippines and another country, and with this agreement, Filipino nurses will be allowed to use their local license to practice in another state where the Philippines had entered the said bilateral agreement. And in return, the nurses from that country can practice nursing in the Philippines using their foreign licenses. Well, actually, the word reciprocity is derived from the Latin term reciprocus. Re means back and pro means forward, so it literally means back and forth. It means that reciprocity treaties are give-and-take agreements. Aside from reciprocus, the Latin phrase do ut des apply here. This phrase means, I give that you may also give. In the principle of reciprocity, the Philippines is giving the registered nurses from another country the privilege to work in the Philippines using their foreign licenses. Only if that certain country will also give the registered nurses from the Philippines the opportunity to practice using their PRC-issued license in that said country's territory. But in the absence of any reciprocity treaty, generally, all licensed nurses from the Philippines are not allowed to practice nursing in another country using their local licenses. And foreign nurses cannot practice in the Philippines using their own local licenses as well. And that is the reason why Filipino nurses must take first the NCLEX before they can practice in the United States of America, or the Nursing and Midwifery Council computer-based test, and the OSCE for nursing practice in the United Kingdom, because we do not have any reciprocity treaty with these countries. Section 21 talks about practicing nursing in the Philippines without taking the Philippine Nurse Licensure Examination. And this is practicing through a special or a temporary permit. This special or temporary permit can be issued for, number 1, internationally well-known specialists or outstanding experts. If, for example, Florence Nightingale and Virginia Henderson were alive, and they will come to the Philippines and practice nursing in the Philippines, can they be allowed? Yes, of course, because they are internationally recognized. It can also be given for foreign nurses on a free medical mission. For example, in the aftermath of Typhoon Yolanda in Tacloban, many nurses from other countries came for help and was allowed to practice because they are here for free medical mission. This special or temporary permit can also be issued for exchange professors. Some universities in our country have linkages with other countries where foreign universities send their students and their clinical instructors, and our universities will also send counterparts as well to these foreign universities. They can practice their profession using their local license based on the exchange of professor program. So the special or temporary permit can be issued for any of the 3 reasons. And the special or the temporary permit is only effective only for the duration of the project, the medical mission, or the employment contract. So don't forget, your nursing license is jurisdictional, except if due to reciprocity or special temporary permit. Next is Section 22, which states that the Board of Nursing has the right to not issue a license to practice nursing for persons who are convicted of crimes that involves moral turpitude and those who have an unsound mind, as declared by the court. When this happens, the board shall explain to the person the reason for the non-issuance of their license through a letter. That is the end of part 6. There is no post-test on this video. See you on part 7. Bye!